Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. Friends, we were discussing about different aspects related to history taking in detail, and we have discussed how to take a proper history, especially in the pediatric practice. And in the last class we have also discussed about how to do the diagnosis. In the diagnosis part, we have discussed the first part, that how to do the anatomical diagnosis. So now once you have completed the anatomical diagnosis, that means you come to a conclusion that yes, this is the anatomical diagnosis. Now second step, that what we have to do is pathological diagnosis. In the first step, anatomical diagnosis, we have confined this particular diagnosis to the anatomical distribution. Yes, patient has got a problem. Definitely he is suffering from disease. Now whether this disease is related to which system of the body, that we have done in the anatomical diagnosis. So now this reduces the chance of error. So in the first step we have discussed, yes, this particular disease is confined to neurological system. In the neurological system also, this disease is confined to the cerebral cortex. In the cerebral cortex also, this is confined to the gray matter. So like this, we have done the anatomical, microanatomical diagnosis. So this will be always the first step. Okay, so just like when we are traveling somewhere and climbing a bus vehicle, first we should know that where we are going. Okay, what is our destination? Similarly, in the first step of the diagnosis, always we have to confirm your anatomical diagnosis. Once the anatomical diagnosis is over, the second step of diagnosis is pathological diagnosis. Okay, there is some problem in the nervous system, there is some problem in the neurological system, there is some problem in the respiratory system. Now that particular problem, what is actually the pathology going on there? Because we have got different types of pathologies. Now, suppose if you look into this slide, the pathology which is going on in a particular system, which is leading to this particular disease, may be an inflammatory pathology. Okay? Or pathology which is going there may be an infiltration pathology. Pathology which is there may be because of infarction. Pathology which is going may be degenerative. The pathology which is going on, the patient has got convulsion. Okay, patient has got convulsion. We know that the anatomical diagnosis is nervous system, and we also know that the microanatomical diagnosis is cerebral cortex. Now in the cerebral cortex, what particular pathology is leading to this particular problem? Is it an inflammation? Is it any infiltration? Is it any infarction? Is it any degeneration? Is it any metabolic problem? Is it an atrophy? See, these are all the pathological terms. Now you have to identify which particular pathology is going on. Atrophy, hypertrophy, fibrosis, sclerosis, or do you think it is an autoimmune pathology? Autoimmune is also a cause and also it is a pathological. Autoimmune pathology and autoimmune cause, both. Now, is it a rheumatological pathology? Is it demyelination pathology? Is it desquamation pathology? Or is it in some dysfunctional disorders? Now this is how you have to identify, because whatever the disease patient is having, it should have some pathology, isn't it? And it should come under the heading of all this, any of these mentioned problems. It has to come under one of the heading, isn't it? So patient is having, now we have to differentiate whether patient is having fever. Along with all these problems, patient is also having fever. That means most probably there is inflammation, or there may be infective inflammation or non-infective inflammation. Okay, if the patient has got a sudden loss of the symptoms, there may be some infarctions, slowly loss of the functions, or already acquired functions that get lost, then it is a degenerative function, deformate. If there is some other symptoms like tachypnea, etc., then there may be a metabolic problem. Okay, if something has been lost, then it is atrophy. If some thing abnormally accumulated, then it may be hypertrophy or pseudo hypertrophy. So like that, you have to go on distinguishing, and this is called as pathological diagnosis. Okay, now this is very important. Now at the end of the pathological diagnosis, we are able to say that yes, this is a disease of a nervous system pertaining to the cerebral cortex, pertaining to the gray matter, with the inflammatory pathology, or with the degenerative pathology, or with the infarctive pathology, or with a hypoxic pathology. Okay, so this is called a second step of a diagnosis. Now same has been mentioned in our science also. What are the different pathological terms which are explained in Ayurveda? And if you look into it, we have got pathologists like Sangha. Okay, the disease may be, Vyadhi may be because of Sangha. Vyadhi may be because of Vimargamana. Okay, in case of diarrheas, or in case of Rakta Pitta. Okay, it may be Vimargamana. Vyadhi may be Ati Pravritti, just like diarrhea. Or Vyadhi may be Siragranthi, vascular problems. Vyadhi may be the pathology may be Marghavaroda, Vata Vyadhis, and so many other problems. Pathology may be Ashayapakarsha. Pathology may be Pratimargamana. Pathology may be Dushti of the doshas. Now, Dushti of the Dhatu, Dosha Dushti, Dhatu Dushti, and Shoto Dushti. This may be the pathology. Sometimes even pathology may be Prakopa. Okay, Vata Prakopa, Pitta Prakopa. It also leads to so many symptoms. Dhatu Kshaya. Then, abnormal Dhatu Vruddhi. Okay, Kayagnir Amshabhagaha Dhatu Sushamshritaha. Tesham Sada Atiditibhyam Dhatu Vruddhi Kshayodbhavaha. So in that condition, that particular Dhatu Vruddhi is abnormal Dhatu Vruddhi. Okay, then Anyonya Avarana, Dosha Avarana. These are all the pathological process which is taking place according to our science. And Dhatupaka may be there. Ama, pathology may be totally Ama, because Ama is there everywhere in all the disease. Or it may be Ama Sanchara, or it may be Ama Visha. So now this is how, when we talk in terms of Ayurveda, we need to concentrate on this. Same has been explained in the contemporary medical science in the form of pathological diagnosis. Okay. Now suppose if the inflammation is disorder, if this is an inflammation disorder, there should be fever. Now fever may be there in the infective inflammation or non-infective inflammation. Infective inflammation means it is always because of a microorganism like virus, bacteria, or something like that. Whereas non-infective inflammation means all the autoimmune disorders or immunological disorders will come. For example, in case of malignancy, there is no infection, but still patient has got the fever. Now this is immunological derangement. In case of autoimmune disorders, actually there is no infection. It is only body immune system is overacting, and the formation of that immune complex is deposited in a particular area of the body, and as a result there is a tissue injury, and as a result there is inflammation. Now this is non-infective inflammation. There is no infective organism. Okay. Similarly, it may be acute inflammation or it may be chronic inflammation. Okay, if it starts suddenly, or chronic inflammation going, it's there since long time with the weight loss and all those things. So how to identify this? How to identify? This is very important. Suppose there is a liver swelling is there with the jaundice and with the acute signs of inflammation. Okay, I am giving an example. A liver swelling is there, and patient is also having jaundice, and patient is also having all the acute signs of inflammation, pain, and all those things. Now this may be a hepatitis. Okay, very clear, because hepatitis, inflammation is there because there is a swelling is there, all the signs of inflammation like pain, fever, etc. is there. Now similar liver swelling may be there without any inflammation also. Okay, so in case of liver swelling is there but there is no inflammatory signs. Now this may be a chronic inflammation, as we seen in case of cirrhosis of the liver. So now this is how a pathological diagnosis will going to help. For example, if you talk about any degenerative, suppose a child is there, child is having attained all the milestones up to 1 year, and after 1 year he gradually loses all the milestones that he's achieved. 1 साल तक बच्चा सही था, और उसके बाद जिसने जो भी उसने अचीव किया है माइलस्टोन, वो धीरे 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 कम होता गया। मतलब 10 साल तक बच्चा चल रहा था, बट 10 महीने तक एक साल तक बच्चा चल रहा था, बट 15 महीने होते होते जो है बच्चा चल नहीं पा रहा है, अभी वो खड़ा भी नहीं हो पा रहा। दैट मीन्स जो स्किल उसने अटेंड किया वो लूज किया। सो व्हाट इट एक्चुअली सजेस्ट, acquired skills are get lost, that suggests that there is some degeneration is going on. ठीक है, it is started after 1 year, probably after 1 year there is some pathology started which leads to degeneration, and as a result there is a developmental regression, and this is possible in case of a ongoing degenerative disorders, or maybe some ongoing demyelination disorders. Okay, so this is the importance of a pathological diagnosis. Now this has to be done before going to the next step. If you, again we can give one more example. Similarly, there may be a chronic inflammation. The chronic inflammation is always less. So this is how we have to identify this. I will not go in detail. Okay, there are many things are there. So I hope you understand this pathological diagnosis, whether you are dealing with Ayurvedic experts or contemporary experts, but this has to be done. First thing is pathological diagnosis, anatomical diagnosis. Second one is pathological diagnosis. Now I am able to say that this is a disease of the nervous system with the involvement of the cerebral cortex, with the involvement of the gray matter, and there is some infiltrative pathology is going on, or some degenerative pathology is going on, or whether some demyelination pathology is going on, or whether some hypoxic pathology is going on. Okay, similarly when I talk about respiratory system, yes, this is a disease of the respiratory system with the involvement of the lung parenchyma, especially the alveolar portion, with what is the pathology? Some inflammatory pathology, or some allergic pathology, or some obstructive pathology, or some infiltrative pathologies. So this is the second step of diagnosis. Now how you have to do this? How can I identify whether it's inflammation, whether it's infiltration? Now again we have to look into the presentation in the history. Okay, in the history you have to see. So that leads, this is the one which leads which needs some practice. Okay, analysis of the symptoms. Therefore I told in the beginning, history taking is very important. In the history taking, you collect all this information and then you analyze. उसके बाद उसको एनालाइज करो, क्या ये इन्फ्लेमेशन में फिट होता है, क्या इन्फिल्ट्रेशन में फिट होता है, क्या ये डीजनरेशन में फिट होता है, क्या ये हाइपॉक्सी में फिट होता है, क्या ये ऑब्स्ट्रक्शन में फिट होता है, क्या. So this we have to understand. So this is all about pathological diagnosis, which is a second step in the diagnosis. In the next class, we will talk about another topic related to the diagnosis, that is etiological diagnosis. Till then, thank you very much, and please don't forget to subscribe my channel. Thank you very much.